All right, everybody, welcome. Yeah, so like I said, those of you who are filing in early, welcome to the February edition of the Kane County ROSC Council. My name is Jared Burton. I'm the coordinator of your neighboring DuPage ROSC Council. I help facilitate these ROSC Council meetings, and I'm very happy to turn it over to your Kane County ROSC coordinator, Annette Villarreal.
Hello, everyone, and thank you for joining. Again, my name is Annette Villarreal, and I serve as your Kane County ROS coordinator.
Yeah, so let's go over what we're going to be covering today. Like I said, we are out here at Town and Country Library in Elburn. A little bit about why we maybe chose Elburn. So when Kane started this ROSC, when it started, a few months ago, we were really looking geographically at the county. So, there's a lot of great services that are kind of centered in the areas like, Geneva, St. Charles, some of those areas. But when we were looking at areas like Elburn, Sugar Grove, some of the smaller communities kind of towards the other side, we realized, prioritizing like equity of services, service delivery, we thought, hey, you know what? Let's make sure we're showing love to this part of the county.
Correct. And so we brought the love here, and we are now in Elburn, Illinois, in the beautiful Town and Country Library.
Yeah. Like I said, if you want to put your name and contact info into the chat, that helps us to take attendance for the state. It also is a great way to network. A lot of people meet each other in this chat and they can kind of work out barriers, talk about collaborations, all that type of stuff. So, Annette, do you want to kick us off kind of with like the check-in, any other type of opening remarks for today?
So we're going to just start by going around and doing like very quick introductions, but at the same time, when you're introducing yourself, your name, your organization, we're just going to ask you to share one word describing how you're feeling today.
Easy enough. All right. Why don't I start? And then if anybody here in person wants to do it, we have the roaming Price is Right second mic, so we can bring that around. Um, but no, I am feeling unstressed, and I'll tell you why. When we got out here to the beautiful Town and Country Library, they have one of the easiest audio visual setups I've ever had to work with, and I've worked with some interesting ones. So thank you. I'm very unstressed today. All right, Annette, what do you got for your one word?
Feeling inspired today.
Okay, why?
Because I'm in this beautiful town and I am here with my council members, and we have a lot of good things to talk about.
All right. Well, if anybody online wants to jump in on an icebreaker just to say hi, you can come off mute. You could raise your tiny digital hand, or if you're here in person, we can go around with the Price is Right mic. So Annette will be out doing that. I see Ben Rudolph. Ben, do you mind introducing yourself to our fine council and then maybe giving us a word?
Absolutely. My name is Ben Rudolph, and I am your technical assistant uh, for Kane County. I provide any kind of assistance that you all need, particularly keep eye on all deliverables. I am your liaison to the state of Illinois. That means I get in front of those people who grant the grants and tell them what wonderful things Kane County is doing to keep this thing going, to keep the ball in the air. Recovery-oriented systems of care means recovery is getting better. Oriented means we're focused. A system means we have a structure in place. And care is nothing but compassion, caring for each other, caring for ourselves, getting better day by day by working together. My word, as always, hope. I am
I love it.
hopeful today.
I love it. Thank you, Ben. I do this every time. If you don't know, Ben used to play jazz piano at the Green Mill. If you know the Green Mill, that's pretty amazing. And I always put him on the spot and embarrass him. But if you appreciate jazz in the Green Mill, that's a big deal. So, Ben, glad to have you. Ben will be at almost all of our meetings. You may even see him in person from time to time when he does his rounds. And he's a great guy, a really good resource to have throughout the state. So, thanks, Ben. Anybody
Great
else
to be
on the
here.
online version want to say anything or check in? I do see. Dahlia.
What, Delilah
Dalila.
Alegria.
Sorry. I'm so sorry about that. I know.
Uh, Yeah, I'm with Inc. Mental Health Alliance. We're a 708 board partnership. And literally, my word is full because I just had a really big lunch. So,
Amazing. Thank you, Delilah. Glad to have you here with us. Yeah, we do have refreshments here too. So if you are on your way here in person to Town and Country, we do have some nice snacks and coffee and everything. So any other in-person folks?
In person.
Now, this is a celebrity right here we're about to talk to.
Hi, everyone. My name is Nini Velasquez. I'm with AmeriCorp and PAX, and I'm serving with DuPage Ross, and I also assist with Kane County ROSC as well. And my word that for what I feel today is enthusiastic. My job, what I do every day, coming to work and serving with Jared and Annette and the rest of my colleagues, gives me so great joy. And we do so many different and great things every day. So it's wonderful. So enthusiastic for my
Awesome.
days.
Glad to have you here, Nini.
Thank
And
you.
we'll probably talk to Nini maybe a little bit later, as well as her colleague Kelsey from AmeriCorps, who've done a really bang up job in making sure that our mobile unhoused outreach units have been stocked, finding collections and resources. I mean, really, we could not have done some of that work without them. So glad to have them here. Anybody else want to check in before we kind of get into the meat of today's meeting? Oh, we got one in person.
Right.
Hi, everyone. I'm Kelsey Chavez. Great to be here with everyone. I'm glad we all made it safe and sound. I work for AmeriCorp through MPEC, and I'm serving at Serenity House next to Jarrett and Annette and my colleague Nini. I'm feeling excited to be a part of this ROSC Council and to make a difference and to spread recovery awareness and how we can help those struggling in the community. Thank you.
Amazing. Great. And then we got another friend of the program, Adam.
I'm feeling joy today because we're all here and out doing the things we need to do.
And I want to say, everybody give Adam some props and congrats. He recently started at Hesed House doing some third shift peer support work, helping out over there. That's a really big deal. Hesed House
And
does a lot of really important
Adam.
work here in Kane County. So yeah, awesome to see like the growth too of people who take positions and internships and things like that. So that's really, really cool. I see a hand raised of who? Walter, our friend here in Kane County. Walter, do you want to check in?
Hey, how everybody doing? My name Walter. I'm the coordinator Kane County grant that Serenity House has with Kane County Drug Court. We also expanded out to Kendall County and Kankakee County, which I'm actually working with today. And do I tell them now about the reentry?
Yeah,
Or is it
why
gonna
don't
be
we
that
do
later?
that? Do you want to intro that, Annette?
You know what? Go ahead, Walter. We are going to be highlighting Walter Sanders. He is part of the Kane County Community Grant. He works through Serenity House, and he's going to be discussing the reentry program, a fellowship that he is starting here in Kane County. So go ahead, Walter. Take it away.
Yeah, so what this is it's a program that I want to start that's helping individuals when they're released from either the county jail, Kane County, DuPage County, or IDOC, just to help them with resources, help them build resumes, apply for schooling, doing mock interviews, help them look for employment, or just, to get them out of the neighborhood, to get them into a different environment. And also, we're going to have guys that's actually currently in drug court, as well as people that I know that have been incarcerated and made changes in their life. They're doing positive things. Come in and talk to these guys. So it's just really something to get them a different aspect in life and something different to do. A lot of guys, it's nothing really recovery based. A lot of guys aren't ready for that, So it's just really to open their minds to making positive changes in life. And I'm ready. We're going to start that on March 12th. It'll be from 6 to 8 p.m. And we'll be first meeting up at the Geneva office. And then if it gets any too big for that office, we'll decide somewhere else to move it.
Quick question. So there's a few of us for like the past few years who've been going in and doing work inside of jails in Kane County and in DuPage County, and Annette's done them as well. I did them for a few years. When you're in there doing those classes like you've been doing, is that where you're taking a lot of the feedback of like what they want when they're being released or when there is a reentry situation? Is that kind of where we're pulling the activities and stuff from?
So, yeah, we're pulling it from that. And also, I kind of pulled it from one of the meetings that we had with the task force a few months back, that was a meeting what made me start thinking about bringing the understanding addiction class in there, just to try to get guys aware of what's going on, you know, and what's going on with their bodies when they are using. But far as this program here, yeah, cause a lot of guys, Jared, in there, they ask about these things, from doing a class when you first started and you brought me in. A lot of them was saying, like they don't really have nowhere to go for resources, or a lot of them is just afraid to make that step, to go somewhere because they're not familiar. So with me already being familiar with a lot of them, now they're hearing about it and they're like, man, yeah, Walter, I'd love to come through.
And I'm sure that they feel like they're coming to a trusted individual, so it's easier for them to reintegrate into the community again, especially when, just like you had mentioned, when we're in the pods with them, they're talking to us and they're, expressing those concerns that they might have because they see the benefits of what they're learning through the classes, and but then they're also wondering what's going to happen, when I'm out of here. How am I going to keep supporting myself, and how will I continue to, the continuum of care, right? Getting those services. So it's, pretty awesome that it's kind of, I see it like we're already preparing them for like their recovery process and their integration even before they're already out.
Yeah. And just to add on that real quick on that, and I think it's also to show them that we're still there. That it just don't stop
that.
inside them classes. Hey, when y'all get out of here, we're still here. And I think that's a big thing because a lot of times they feel like once we leave from out them classes, that might be it.
I wanna real quickly maybe give a preview of some stuff that's coming up this year. I can tell you, one need from when I was in doing classes in the jail, and I think all of us who've done reentry classes, the biggest anxiety for a lot of them is finding work. So not only finding work, finding gratifying work, right? Finding dignified work, ways where they can make good money. A lot of them, maybe haven't worked a quote unquote legit job in 20 years, right? Some of them maybe have only made money a certain way for so long. So to have to make that change, how do you see that type? Is that like one of the biggest jumps for reentry people sometimes?
Yeah, it is a big jump, and I think that's where like people. I could speak far as myself. When I first got out, I just had to, get what I could get, and be grateful for that, and then just wait till something better come along. I just had to build from that and learn. It's a lot of education. It's a lot of education out there and it's free. So it just, a lot of people want the money and they want the fast money, but at the same
Yeah.
time, we have to take what we could take and build from that, and be grateful for what we can get into something better come along.
So this, like we said, it will kick off on March 12th from 6 to 8 p.m. over in our Geneva office. Looks like we had a question, and then if anybody online had a question or comment for Walter, either about this or just some of the jail programming in general. So Kelsey, you had a question?
My question is, where's this location, the Geneva office?
So it is, what's the address, Walter? That's your home base these days.
825 West State Street. It's in a little building there with suites, and it's suite 115.
Beautiful.
I
Ned,
got to get
anything
more
else?
flyers out. I've been lacking on passing the flyers out. I need a lot more flyers printed out.
Well, listen, we can share this with the council, and if people want to share it through their networks, that's a great way to do that. So yeah, we'll help you with that, buddy.
Okay.
All right, thank you, Walter. Really, really looking forward to this. Any last things for Walter and Ned?
And we really appreciate, you taking on the reentry program. And I know that it's so needed. And I'm looking forward to seeing what happens.
All right, thank you. And I appreciate y'all for, all the support y'all give me and how much y'all help me. It's Serenity House. It's a great place, and we just one big tree, and I really appreciate everything.
Yeah, well, We love doing it together. So thank you, Walter. We appreciate you, buddy. If anybody has any questions or if like you want some flyers, just put it in the chat. We'll make sure you get those. Now, before we go on, it might be a good idea because I don't think we maybe have given the full like definition of a ROS. So maybe if somebody's here for the first time, like what it is this program does. If you
So
wanna do
we're
that.
definitely going to get into that now. So just in general, we'll talk about what exactly is a ROSC. So a ROSC is a recovery, it's the recovery-oriented system of care, is a coordinated network of community-based services and supports. Now, what does that actually mean in practice? Well, it means we are designed to be person-centered. We built on the strengths and resilience of individuals, families, and communities to foster recovery and improve quality of life for those with or at risk of substance use and mental health conditions.
And one important thing about our organization, we are led by people with lived experience. So that could be someone like myself who's in long-term recovery, or Annette.
Myself as well.
It could be someone who has a family member who's been touched by addiction. I think almost everybody knows somebody or has been touched by addiction at this point. So it really is a very person-centered, community-focused program, and we collaborate. We find out what we're working on individually, and then say, hey, can we tackle the gaps? Or can we tackle the barriers in Kane together? And we're so excited to be here. We started Kane, about 6 months ago now. And we just love the projects and the momentum we've been able to do so far. And that's mostly because of y'all like hosting us at these meetings and all kinds of stuff. So what do you want to get into next, Matt?
So let's talk a little bit about our mission, right? Because we talked about what a ROSC is, but for people who are here for the first time, we want to just, and again, for our council members, we want to review what our mission is, right? So our mission is, as defined by the state funders, which is the Illinois Department of Behavioral Health and Recovery, is to create a true system of care at the community level. We are here to connect the dots. Think about the entire continuum. It's prevention, intervention, treatment, and long-term recovery support. Our job is to make sure no one falls through the cracks between these dots.
Yeah, and that's really important. So we try to identify gaps. We try to identify strengths, right? What is pre-existing? What are the people out here who have been doing this work so far? You know, we're very much a supplementary organization and one that uses the strengths of everybody who's been out here doing the work. So that's kind of the long and short of a ROSC and what we do out here in Kane County. And what next?
So let's talk a little bit about what our vision is here in Kane County. So the County ROSC Council envisions a community where recovery is not only attainable, but it is actively supported and joyfully celebrated. We strive to be a beacon of hope, health, and lasting wellness for all. That word joyfully, which we heard today too, and that Adam shared, is important, right? Recovery is not just about surviving, it's also about thriving. So a successful ROSC Council doesn't just meet and talk. We are the community's action for systems change. We do have grants, right? And one of our grant agreements requires us to target key challenges. And so how do we target these challenges? By developing goals, right? So our work is guided by 5 core goals, right? They're established again by that.
Real quick, these are like I want to hammer these home at every.
Hammer them in.
These are the sectors that we have been doing some work in, but we need to continue to be doing that work in, and I think they're really important for our county. So what are those sectors?
Are reducing stigma around substance use and mental health, promoting medicated assisted recovery, advancing harm reduction strategies like Narcan distribution and services, improving service delivery to make it more accessible and coordinated, and prioritizing equity so that every person, regardless of background, can access care.
So we really try to look at our organization as like problem solvers, but that's like a collaborative process, right? We can't solve problems on our own. We all kind of work in similar fields, right? We're all pulling towards the same goal of wellness for substance users and folks who have mental health challenges, but we don't get a chance to work together that much. So it's important we get to have organizations like this to get into that.
So now that you just said that, it is critical, right, that we have these plans that help inform us, right? And now that we're talking about a little bit about plans, we do create a strategic plan for the fiscal year, right? And so for this fiscal year, 26, which many of you helped shape, right? And we're still in our infancy. We've established concrete goals to strain our governance, reduce stigma, and expand access and integrate equity. And again, we don't guess and we don't assume.
We try.
We always listen to what the data, right?
Yeah.
So that includes information from several different data sources, right? Particularly like the Kane County Health Department, the Kane County Coroner's Office, and several other sources that we use here in King County. So let's talk a little bit about what includes our demographics, right? In our profiles, in the profile that we highlighted recently during our survey. And
we want to go through the question part first. I think we have the demos at the end, so that might be a good way to wrap up
well,
these.
let's do it.
So if you're unfamiliar, every ROSC in the state
Mhm.
has to do these every year. Like Annette said, it's data driven. We can't just kind of guess and hope and pray about what the actual problems are. We use a lot of these findings to kind of steer the ship. DuPage has done it for a few years now, done focus groups, qualitative stuff. But this was the first full-on survey like this for Kane
Yes,
County.
it was. It was our first time, right? Because this is our first council and here in King County. So yeah, it was interesting. It was I don't want to say it was difficult, but
I mean, these surveys are always a little tricky. I think sometimes to get really good numbers, you have to have, a good team to be able to go out, work on these things, but also, understand there's like survey seasons. I mean, I filled out like 5 surveys in 1 month, like major surveys for things. So sometimes it can be tough to get that because of survey burnout and other things, but we have to do the best we can to get these answers from folks, both online, but also, physically, right? Like going out into the community.
So we physically went out. We did share, disseminated the survey through our partners, right? And we did announce it several times through not only here at our meetings, but through social media. And we also went out and did one-to-one outreach. And what I mean by that is that we had our outreach coordinators out there handing out flyers, introducing themselves, sharing the information on the survey and advocating for it, right? But we also were out at grocery stores. We were out at laundromats and gas stations.
Yeah.
We had a lot of you're not welcomed here.
No, go away.
Go away. But you know what? We do want to appreciate and be grateful for the people who did take their time out and did answer these questions because again, just like Jared had mentioned, surveys can be a little taxing, right? And not everyone wants to just pop up their phone or answer 20 questions, when you just met someone, right? So again, we are very grateful for the number of surveys that we did receive back.
So we're going to go over some of these so you guys can kind of get a snapshot of the feedback we got for these questions. The state asked that we include some questions in here too, but we look at this largely as a really good kind of overview, generality of like, what does the continuum look like out here? What are attitudes and awareness of services that are pre-existing? And are there any things that are just we're really kind of maybe lacking out here? And we want to try to not use like negative language around it. It's more like gaps, strengths, things like that. So now these first couple questions, they may seem like a slam dunk, right? So what does this first question say?
Actually, I'm going to walk you guys through the key findings, right, from our community needs assessment survey. I again encourage you to listen, keep these questions in mind, and if you do have any questions, we'll appreciate if you keep them till the end of the presentation. But we do want to hear from you and what you feel.
Yeah, just feedback.
Yeah, just feedback from our survey. So first, the good news, right? The positives that show our community's heart. So question 1 and 2 stated that over 78% of respondents agree or strongly agree that individuals who use drugs and those with mental illness deserve to be treated with dignity and respect. That This is a powerful foundation. The question tells us that the core value of this council, which means everybody, is shared by the broader community, right? So on question, where are we on? Question
I'm just going
two?
through
Yeah.
one, two.
So can we go to question
We
three?
sure can.
So 76% of people agreed that medicated assisted recovery, or MAR, is effective. Again, this is important because MAR is sometimes misunderstood.
And for anyone who doesn't know what MAR is, because there's people who might be here for the first time, what that means is medication assisted recovery. So that might be somebody who is on a maintenance medication like Suboxone or methadone or even Vivitrol. So that's what they're referring to there. Are those substances an effective way to treat those?
And before we move on, I do just want to share that the survey was completed by 88 individuals in the community. So just to keep that in mind when we're talking about these percentiles, okay? So now we'll move on. So question 5, 76% affirm that harm reduction services like Narcan distribution and syringe access programs reduce health risk.
Now,
Again, supporting with strong support, right?
yeah, now that's an interesting. I've said this before in other statewide ROSC things. I feel like that's an interesting way of phrasing that one because I think in some people's minds, when they're talking about harm reduction, Narcan and syringe exchange are on two very
Very
different
different.
sides,
Exactly.
in their mind at least. So this will be something we're not going to dig into too much right now, but
No.
maybe in the future that'll be part of a larger conversation of are we stigmatizing our own MAR programs out here? So that should be an interesting conversation when we get there.
And in question 8, nearly 88% said that they wanted to, and I want to emphasize that number, 87.5% supported increased government funding for mental health and substance use treatment.
Yeah, can we everyone memorize those numbers and then tell them to your local governor or local government? But yeah, this one's always important because obviously we're only able to do the work that we do through grant programs. Data is huge for the grant funding process. So go right ahead.
So again, all these positives, and what do they tell us? It tells us that we have a progressive, evidence-informed community, right? People understand that these are public health issues and not moral fallings. This means when we advocate for policy changes or more resources, we are not shouted, we're not shouted out into the void. We have public sentiment on our side.
Amen.
So now we'll talk about some of our challenges and where we focus our energy. So in question 4,
You go back up to 4. All right, go right ahead.
nearly 47% of respondents said that finding an MAR provider in their community is difficult. So people support it, but they can't find it. And that is an access problem.
Yep. Next question, which would you
So
like to go
question
to?
11.
All right. Everybody sit tight. We're getting there.
Question
Here we
11.
go. We're at it.
Only 22.7%, fewer than 1 in 4, agree that it's easy to access detox or treatment services in Kane County.
Can I talk about this one for a second? I
Yes.
think this is one of those eternal gaps or barriers to people. In my experience, it's sometimes, A, about knowing what's there. B, once you know what's there, are you able to be treated there based on, your health insurance condition or your transportation issue or your citizenship or your ability to speak the language. So you can kind of see just because they're there doesn't mean that these people are able to access them easily, if that makes sense.
Makes total sense. Thank you for sharing that, Jared. And for question 12, just 25% believe that there are enough sober living homes available
This is, yeah.
It's everywhere.
This is going to be a big one too. If you've been, I think a lot of you attend the DuPage meetings too. DuPage Health Department and us and a few different sober living organizations have been putting on a stigma reduction campaign around sober living. I saw Brianna's here from Oxford House. We also had Mariana from Evergreen Sober Living. And they started running last week. I think last week was Evergreen, this week some Oxford House stuff, and then Serenity House will be the following week. So, we're doing the best we can to kind of educate the community on what sober living is, but also what sober living is not. I think that's one of the biggest misconceptions about, letting or wanting to allow sober living options into the community is those misconceptions, right? Like it's a flop house or it's a party house.
Or we're going to have people in and out at all times of the day and night.
Yeah, and if I can speak just for a second from personal experience, lived experience, and doing outreach for sober living homes, I've gone to city council meetings, and I've gone to chamber meetings, and I usually don't tell them until the end that I'm a person in long-term recovery, and then you kind of see the attitudes change at that point. And I don't do that to put anybody on the spot or to make anybody feel silly. It's just that I want people to know that, like, we're out here in these counties. We need these types of housing options available. And sometimes we have to do what we have to do to get those put into the communities, right? So again, always a huge topic in our counties, and you'll continue to hear more about it.
Thank you, Jared, for sharing that. So what does this tell us? There is a gap, a real support for services and actual access to services. People want help, just like you said, but the system is hard to navigate. This is precisely why a ROSC exists, to connect those dots and break down those barriers. So now let's talk about stigma.
Oh yeah. Which question are we on now?
So we'll start with question 13.
Okay.
Because actually stigma, this is very personal, for myself. I don't know about you, Jared, but
we can talk about it.
Yeah. So question 13, over 78% recognize that the language we use matters. Stigmatizing language, words like addict, add to the stigma. Question 14, a striking 80.7% agreed that stigma itself, the fear of being judged, keeps people from seeking help.
Some of the time too, that's from past experience. We've talked to some clients or people that we service in our community who will say, they don't feel comfortable going to ERs because of the way maybe they were treated when they were showing up for, seeking detox or, seeking mental health challenge help in there. So there is traumas that are attached to that will keep people from seeking services. The other one that we've talked about is the language barrier. If you're somebody that doesn't speak the language, just finding services can be tough, but also imagine presenting somewhere for treatment for something and you can't communicate with them and you can't understand that communication. You can see why the gap is still there. Now, a lot of organizations are doing great work and making sure that, there's bilingual staff to help meet that need, but it's going to continue to be a need out here.
And, it's not only just the substance part, but it's also like the mental health part, right? I mean, that's very huge. It's not until lately, right after COVID, when we started really talking about mental health, right? Before that, it was kind of, how would I say?
Secondary to the substance.
Yeah, and no one really wanted to disclose. I'll talk about myself, I'm a person with co-occurring disorders, right? And with my mental health, I've had anxiety, general anxiety disorder. I suffered, from postpartum depression, and I had several other, things going on, besides my ADHD and my dyslexia, right? And so, when it came time to, like, even for employers, right? Let's not talk about my, my record due to my, my other, issues, but just disclosing, like, hey, I have this condition or I have this going on, was very hard. Not just because I didn't want people to look at me differently, but also because it's like a double sword. People can kind of, you also are kind of scared of saying things because people will use it against you, and so it's hard. It's really hard, but I want to just, I also just want to take the time and say, like, once you do disclose, it's so like
It's huge. It's hugely helpful.
so helpful. And
Yeah.
I feel like just like my recovery that I live out loud, I live my mental health conditions out loud as well. I have no embarrassment of sharing that with anyone. I'm happy to, help anyone through it, and walk them through it a little bit if I have to, and use myself again as an example, right? Because that's what we're here for.
Yeah. So stigmas, we're always going to. By the way, this young lady was the face of a stigma reduction campaign last year. She's being way too modest, but yeah, she was the face of co-occurring disorders in DuPage County. Congratulations.
Thank you, Jared. Thank you for sharing that, Jared.
I'll try to find the link to embarrass her. I'll put it in the chat. You don't have to worry about it. Okay. Sorry.
Embarrassing. Actually, I'm very honored to have been that, and I was honored. I was just honored, and I'm still honored that I can say that I was that person.
Yeah.
Thank you very much, Adam.
All right. What questions next? What do you want to get to?
Again, let me just talk a little bit about what the part of stigma tells us, right? Stigma isn't just about hurt feelings. It's a systematic barrier. It literally prevents people from walking through the doors to get care. And this validates why we, and we'll talk about that in a few minutes, we'll start thinking about our Language Matters campaign, right? Yeah. So again, go ahead, Jared.
Yeah, we'll get into the next one. Also, just a couple other things, right? So we try to, gauge what services are out here and what people's attitudes and awareness of the services are. This was a question we talked about in DuPage in first year. How are we looking out here as far as just like regular healthcare services? We've talked about substance use and mental health. What about primary care physicians? What about, pharmacies, minute clinics, the kind of quick clinics, and also, mental health facilities. I'm talking about primary mental health facilities. For our residents who are uninsured or underinsured. I mean, that might sound like a broken record to people who've been in these meetings, but we all know that for the large parts of our jobs, insurance is like the 1, 2, and 3 problems that we deal with in finding placement for clients, right?
So let's talk about the equity gaps, right? These were significant, right? In question 9.
Okay, go back up to 9.
Okay, and 9 and 10, only about 30% of respondents believe that everyone can get help regardless of their income, insurance, race, or language. And that we were just talking
Well, a
about
big one
that.
too, and we're also talking about like gender identity, sexual orientation. There's often a need for specialized services. We found this out in DuPage too when we were getting up and running. We were looking at like who didn't have a seat at the table traditionally. Maybe that was like our awesome LGBTQ IA plus groups. Maybe that's like our youth serving groups. And that's got plenty of those we can talk about at some point.
No, and actually you just went through question 15, 16, and 17. No. So
sorry guys.
No, you're good, Jared. So actually on question 15, it said just 29.5% see adequate services for people who are uninsured or underinsured, right? And we're dealing with that every day now, especially, with what's going on with our, human services department, with the insurance and Medicaid and the funding. And so, yeah, I can definitely see why people were saying 29.5% saw that.
So you said 16 for the English question.
Question 16, only 23.9%, fewer than 1 in 4 believes that there are sufficient services for people with English language barriers. Now, I can attest for this because I am a dual language speaker, right? My first language is Spanish. And I've been around before I took on this position. I was like my counterparts here, Nini and Kelsey, I came on through AmeriCorps, through Recovery Corps. And during that time, I served as a project coordinator throughout DuPage County. And again, just like Jared had mentioned, and of course, here in Kane County, I have, I myself have seen it. I mean, there are robust services. There are services. Unfortunately, these services are provided only in one language, right? And not only the services, some of the supports as well.
Right.
I have heard of, support groups that are in Spanish, right? But they're far and few. A lot of the CRSSs that I've encountered, which can actually, really help with the gap in services. Again,
Can I talk about
limited
a gap
Spanish.
too that with the language that I'm sure you ran into as well? When we would go in to do classes in, say, the jails, right? King County Jail, DuPage County Jail, we would have, and I mostly did the male side of the pods, but we would have 4, 5, 6 guys who wanted to take the class, but could not speak the language and couldn't find somebody that would just translate to them for the entire hour. And
Actually,
we would try to find ways around that, like that.
yeah.
But unfortunately, I'm not a dual language speaker, so I was doing the best I could, to make sure we were offering that. But
So actually, a few weeks ago when I was in the pods here in King County, I do anger management class, and we had an individual who only spoke Spanish, and he did want to take part in the class. But unfortunately, the way the class works, you have to do some self work on by yourself in a workbook, and the workbook is only provided in English. And again, there was someone who was willing to interpret for him,
Yeah.
right? Another cellmate, but some of that stuff is very personal.
Oh yeah.
We're talking about anger, we're talking about triggers, coping
Trauma.
skills, right? And you have to
Yeah.
write a lot of your own, personal information inside those workbooks. And that wasn't going to happen because, I mean, I don't think he wants his cellmate to know his most intimate triggers, right?
Yeah.
That's very counterproductive. So he had to, he had to decline the class, but they actually put him like he refused it,
Oh gosh.
which is
Well,
so sad. And
yeah.
this is exactly why I can attest that we really have to work on, these language barriers. And not only for Spanish, I mean, we need Polish, we need Arabic,
Ukrainian.
we need Ukrainian, Indian, everything, just a little bit of everything.
Yeah. Sign
language. Thank you, Adam. That is so important as well.
I want to touch on this one. I know I mentioned it briefly, but specialized substance use and mental health services for our LGBTQIA plus friends. You want to talk about that one briefly?
17, only 23.9% feel that there are adequate specialized services for the LGBTQIA plus community.
Yeah, so that's something we always got to work on. I don't think that's unique to Kane either. I think there's always some work to be done with some of these, like we said, areas that maybe traditionally don't have a seat at the big table. So we're trying to make sure they do. What's another one? We might wrap this up in just a couple minutes.
So yeah,
what else?
so again, let's just keep in mind that equity is just not a buzzword. It's a strategic plan, right? So it's a critical, urgent need. So let's just summarize very quickly on our high need areas: access to MAR and detox services, equity and care for marginalized populations, language access, LGBTQIA services, and stigma reduction.
All right, that's pretty good. Now we're gonna obviously offer these results and this stuff up for anybody who would like to see them. We're happy to share that. It'll be posted probably too on the Governor State ROSC stuff when we turn all these things in, so you can have access to this stuff and see, kind of more in depth some of this stuff. Look at the answers, some of the more the numbers, dig in a little bit more.
Of course, and if anybody wants these slides, they can feel free to email me, and I'll be more than happy to share that.
How about if there's any questions about kind of the stuff we've gone over so far, we can do our best to maybe answer them here in the next couple of minutes. So either online or here in person, if there's any questions, you can let us know, and we'll do our best. Is there anybody online that has anything? If not, that's cool. I know we laid a bunch on you. I see Ben coming off mute.
Yeah, yeah. I got just an observation. Like I say, I work closely with the state of Illinois, and we look at all the surveys. And one of the things that I've been bringing up when we have meetings and talking to people are the people who neither agree nor disagree. They're
Yeah.
somewhere in the middle, and they're a group that can be pushed in one direction or another. Sometimes the ones who disagree or strongly disagree, they're kind of more on the belligerent side. They're going to dig their heels in. They don't want this. They're no, no is it's always no, no matter what you say.
Not in my
But
backyard, right?
right, but this middle ground, and it's also like electricity because each group kind of touches on the other. So if we can find a way to neither agree nor disagree, to push them over to the right side, to have an opinion, to identify who these folks are. And it might be just something like education or listening sessions or anything that can help connect them with us and get them over to our side. So I have found that trying to find that group that who just, they don't seem to care one way or the other,
Right.
to kind of give them some information. To educate them, to listen to what their concerns are, to get them over on the side of support rather than just like, I don't care.
Whatever, whatever.
Yeah.
Yeah. Well, thank you, Ben. That's a really good, insightful take. Yeah.
Observation. I didn't think about that. Thank you, Ben. So how are we responding, right? So what can we
Stop sharing this real quick.
what can we recommend from the data? So how are we responding? Let me give you a concrete example of how this data is translating into action.
All right. What's the
So
first one?
we're going to talk a little bit about responding to the equity gap, right? So
Okay.
the survey told us that, we had limited services for non-English speakers. So now, we do have an office in Geneva, and Serenity House is now providing bilingual peer support services out of that Geneva office every Tuesday. That is every Tuesday from 12 to 2. We are also actively, as always, recruiting members for this council who are dual language speakers. And we would love to have you here at the table, like Jared had mentioned. And we're also committed to translating key resources, right? Like support resources,
Literature.
transportation, literature, anything that we can possibly use, we are willing to translate that into Spanish.
I'd also like to say real quick, these drop-ins too, if you're from an organization that works in Kane County and you'd like to come and either hang out during one of these drop-ins and see what we do, or if you'd like to come out and provide a service, if you do a specialty service, the Serenity House people would probably love to have you out there at that Tuesday drop-in. So yeah, and there's also going to be a virtual Narcan training added to that. So be on the lookout for that coming up.
So again, how are we responding to the access gap? So we are broadening access to services by going out in our mobile outreach van, right? Now it's operating on Sundays. So you want to talk about that really quick,
Yeah, we'll talk
Jerry?
about that real quick. So, if you're unaware, I'm going to give some flowers to a colleague who's not here with us right this second. But if you've maybe at a previous meeting, you may have heard us talk to a gentleman named Rory Green. Rory's worked with us. He originally was at LSSI. He's got his roots out here. I think he lives in Elgin. But he's worked for us for about the past 2 or 3 years. He has a outreach group called CW Second Chance Ministries, and he has been going out on twice a month to the Animal Control Center parking lot, catacorner to Hesed House. That sounds very specifically familiar, but if you've been out there, you know exactly what I'm talking about. So he's been going out there with his partner Calvin for a couple of years now to provide some warm food, but also clothing and some other things, specifically not necessarily for Hesed House people, but for the tent city folks who are living, like we said, in those tents that are back behind there in Aurora. You came out with us this week, so what was your experience when we were out there?
Again, I mean, it was energizing, motivating. It was fulfilling. I mean, just gratifying, just a bunch of words, right? I was just, just happy to be able to serve that community.
Yeah. And so let's talk briefly about how you can get involved in that type of thing. So as we said, we go out and support in a support capacity AID in Aurora and Elgin during the week. But like we said, we're out there on Sundays and we will be adding new locations coming up. So we're looking for some spots maybe in Aurora. We're always looking for spots in the Elgin area, places where the people are. That's the other important thing. I'm not necessarily even interested in saying, oh, we got somewhere in Aurora. Tell me where the people are. And that's part of this, right? Where are we going out? Where are the organizations collaborating to find out, are there overdose spots, right? Is there hot spots for dealing or for unhoused folks? A lot of stuff on the van is what you can get involved in. And Adam's here. He was fantastic. He dropped off a bunch of toiletry kits, some hygiene products, socks. People on this call have gone above and beyond in donating stuff. I can't go through everybody right now, but also you want to give some props on that?
did have a section here about,
yeah.
talk, when, about talking about how we're responding, right? And in one of my sections, I did have, just for the sake of time, I just wanted to shout out Mark Matthews from Greater Family Health, who had donated socks for the van, and Cheryl Cryer from Urban Apothecary in Batavia, right? She's donated several times. So many different items. I can't go through it, right?
Coat.
Adam Polly, right, who's a dedicated community member, right? Not only that, but he's also organizing a diaper drive. This is the gentleman, ladies. This is him. I also wanted to shout out the Byrne family, right? The Byrne family has supported us also visiting the drop-in center, but they've also donated several items, okay? And again, we also wanted to give a big thank you and shout out to the Elgin Community College and
Yeah.
College of DuPage for hosting donation boxes for us, right?
Huge. So we, are sometimes it feels like me and Annette are in the donation business. Like every time I turn around, which is a good thing, right? Like if we're getting calls of like, "Hey, I've got 3 bags of coats for you," we will find a way to get those coats. So thank you to everybody who's done this. We will be probably transitioning into spring and summer clothes soon, but that doesn't mean we cannot stock up.
And actually, soon we'll start sharing some pictures of
Yes.
when we're out there doing the outreach during our Kane County meetings.
Yep. That'd be huge, yeah. So you can go on we have our Facebook page. We have a DuPage and Kane County Facebook page, and you can find some photos there. What's next? Oh, do you want me to plug this one real quick? And then
Go ahead for the sake of time.
yeah, for sake of time. If you're ever looking for some cool presentations, we try to do them. We do them both here in DuPage and in Kane. We've got one coming up next month. These are on Zoom, so you can always just zoom in. We try to touch on topics that are like timely to the recovery continuum, or just like topics that we've been meaning to get to spend some more time on. Like at these meetings, the best we can do is like 15, 20 minutes at the most. Coming up next month, I'm going to be doing ADHD and the stimulant pipeline. So we're talking a lot about productivity culture and that sort of like, be the best at your thing culture, and how that's been driven largely by youth now, and prescription misuse through stimulants at college and other things like that. Fascinating. So I hope you guys can make it out for that one. Do you want to press this one? Because this is even more fun.
Oh, please join us at our sober event. It's going to be held at the Big Hall at Serenity House in Addison, Illinois, but it's our game night, right?
Oh, yeah.
So, I I don't even know how to explain it. It's just think of a big room, think about lots of games, tables, think about a big screen with video games, think about karaoke, think about like
Giant Jenga thing.
giant Jenga, think about like
Unos, multiple Unos going.
yes, and think about like groups of people getting together and playing like all these cards and all these different games. You could bring your family members from the youngest to the oldest. Think about snacks.
Oh yeah,
Refreshments. We're gonna feed you, and think about it's gonna be hosted, and there'll be a mic, someone out there. I don't know if it's gonna be Jared again, but it'll be somebody, right?
Host.
It'll be somebody, right? And we're just gonna have a lot of fun. Just come out and have fun with us.
Come out to that one. We would love to have you. Like we said, we throw like Mario Kart on giant big screens. It's really cool. And there's always a trophy for the video game GOAT award winner. And it's actually a GOAT trophy. It's got a tiny goat on it. It's a lot of fun. So I hope you can make it after that one. Sorry to jump in on us. Annette, what else you got?
You're okay. Do we have anything else to share?
That's all I have on the shareables, but I'm going to stop. But if we can maybe open it up if anybody else has events and stuff.
Yeah, exactly. So for the sake of time, we have a few more minutes left. We do want to open up the floor now for any questions, comments, remarks on anything that you saw on our data review from the survey, or anything that we spoke about, or just share just share any information that, or any upcoming events that you might have.
Needs, collaboration,
collaborations,
type of stuff. This is where we do them. So you can introduce yourself online if you want to just come off mute if you got something to promote, or you can raise your little digital hand and we'll get you in there. Or if you're here in person, we can come around with the Bob Barker Price is Right second mic.
Again, I'll just promote the drop-in on Tuesdays, right, from 12 to 2. Keep in mind that drop-ins are not only just for anyone just in the community. It's also for like other professionals, right? I've been lucky enough to have Sharon Cabrera from the health department come and visit me. Adam Polly has come and visit me. Cheryl Cryer has come in. Mark Matthews has come in, and we do a lot of networking when we're there. I mean, right? Me and Adam have talked about a few things that we might be collaborating together with working out here in the communities out here, you know, in Sugar Grove and Elburn, and other areas out here. But yeah, I
I
mean,
think too, we want to like maybe book specialized things. So like
okay.
maybe one, day we're out there, it'll be like free HIV testing, or collaborate that way. Or then the next week, if it's a specialized service they want to come do. I know that we got offered drug testing on the site, drug testing too. So that's stuff people are still using just to avoid misuse. But yeah, it's a lot of fun out there, right?
And again, we want to remind everyone in the virtual world, but out here too, that our services are not just the mobile van, right? We can bring services to you and to your organization.
Yeah, we're connectors.
Yeah, we
Great
are
connectors.
connectors, and so if there's like where we're here in Elburn, right? It's a beautiful place. It's a little far, from what I might think like a metropolitan area, right? But
I know.
and I
I'm ready
say
to
it
move
very
here.
vaguely because
I'm
I'm
ready
from
to
an
move here. I
island.
love it.
I lived in Puerto Rico. I'm from an island, right? And the island, when where there's on the island where it's more populated, we call the metropolitan area, right? Like more downtown areas. But yes, so we want to
We'll
bring
be out here.
services out here. We want to connect. We want to make those connections. We want to connect those dots out here.
Let's get to Delilah. Has something to promote.
Yes, and this is more organization
Yeah,
announcement, but
absolutely.
we are a funder of mental health, developmental disability, and substance use disorder services, and our funding application is open right now, and it is open through March 13th. Closes at 4 p.m. So if anybody is interested in asking about funding, please feel free to reach out to me. My email is in the chat. Our website has all the information on how to get access to our funding portal and our objectives and all of that. So please share.
Awesome. Thank you. We definitely will. Yeah, if that's in the chat, people can check that out. There's a lot of
Thank you.
funding out there, folks. Make sure that you're trying to secure some funding to do cool stuff like this. Anybody else online have any updates, like maybe your organization, or if there's a meeting you go to that could use support, anything online? No?
Before we go to, I just want to share that we are still looking for host sites.
Oh yeah.
You
Let's talk
know,
about that.
we were lucky, and we were honored that we were able to get hosted here at the Town and Country Library. But
Gorgeous library, by the way.
yeah, it is. It's beautiful. It's right. It's so beautiful here. But again, we still haven't secured anything for next month.
I think we're okay for the next couple months. I think I'll confirm that. But the point being, we need some host sites. Yeah. Yeah.
So if anybody is gracious enough to host us, please reach out to me.
We're good. We're good guests, by the way. We clean up after ourselves. We usually
We leave snacks.
leave snacks. Yeah. All right. Well, we may give you 2 minutes of your day back unless anybody has any last announcements or anything. Adam, let's make sure. Yeah, let's make sure you get a mic. Hang on one second. Yes, sir.
I just have a quick question. So I've heard a lot of us versus them type of attitude, and kind of has to do a little bit with stigma, but like people that may be using drugs or maybe going through mental health issues or even are homeless, I've heard it's a lot of, oh, it's them.
Yeah.
Oh, it's maybe that's a left thing or it's them. Does anybody here redirect?
So as opposed to like, yeah, them, they, those people, that type of thing.
It's kind of hard because you have to remember that when you're out there, you're unsheltered or you're going through whatever challenges you are, it's easy to find a group of people and think about it like this is your family, this is your community, and they're very, believe it or not, they're very protective.
Yeah.
And again, not only is it that they're protective, but they're also, they're probably feeling like, oh, this person's going to judge me. You got to remember that there's stigma around that too, right? And there can be several things. It could also be a language barrier. But
Language matters. You're gonna hear that
Yeah.
phrase coming up because when we touched on that slide
Mhm.
with like junkie, crazy, even words that we don't think are stigmatizing.
are
If you're somebody that lives with those conditions, they can very much be. So I think language, and we may
language,
put that in.
but you know what? From my experience from work doing outreach, right? If you're just consistent and you show up, even if you don't talk the language, but you just provide like whatever service, people will keep showing up. And eventually they'll talk to you, even if it's not in your language, they'll talk to you with their hands, they'll talk to you with their face, with their smile. You'll
Body
break through that.
language, all
You
that
just
stuff.
have to be there, be consistent, and just show up. That's it.
But you're right. We should all try to work to not other people, right? That's really what it is. It's that othering that keeps us separate from quote unquote, the rest of society, and that's what's tricky.
All one.
We're at 3 o'clock. Listen, this has been a wonderful day over here in Elburn. We were so thrilled to be able to come out here.
We're so thrilled that we got, we have people in the audience. We appreciate you coming and, spending your afternoon with us.
And online,
And
too.
of course, our wonderful community online. We appreciate you guys so much.
Do you have the date for the next one?
No, well,
As I furiously look at my phone. Hang on a second. I can
yes,
tell you.
you pop up the date, and I think it was May 20.
It is March
March?
19th. March 19th, everybody.
March
March 19th.
19th. And we are looking in the Sugar Grove area at this moment because we
Yeah.
want to go out to Sugar Grove. So we will be informing everyone. We'll put it up in the calendar, and I'll send my traditional emails, everything that I send out with the flyer included where we will be hosting it.
Amen. If this will be up on the YouTube probably in the next day or two. So if you know somebody that couldn't make it, they always go up on the YouTube. So yeah, thanks again. Thanks everybody for speaking. And yeah, we'll see you at the next one. Bye, everybody.
One.